Let's see an NCLEX RN video based on assessment of renal and urinary function. The nurse caring for a patient on a urology unit recognizes that which of the following laboratory values indicates the highest priority need for further assessment and intervention. Serum uric acid 12.5 mg per dl, serum calcium 8.8 mg per dl, serum potassium 4.8 milliequivalents per liter, serum blood urea nitrogen 20 mg per dl. Normal uric acid values for adults are in the range of 3.5 to 8 mg per dl. So value which is greater than 12 mg per dl are critical and warrant immediate intervention. Excess uric acid is termed hyperuricemia. It can result in the development of gout. Inflammatory arthritis is caused by uric acid crystals in the joints and in severe cases can cause renal damage. All the other values listed here are within the normal limit. The nurse recognizes which of the following patient is at the highest risk of developing bladder cancer. A 75-year-old male with a history of diabetes, a 40-year-old female with a 20-year smoking history, a 30-year-old female who works as a hairdresser, a 52-year-old female with a history of frequent UTIs. Smoking is a greatest risk factor for the development of bladder cancer. Diabetes and frequent UTIs are not known to increase the risk of developing bladder cancer. Certain occupations including hairdressing increase the risk of developing bladder cancer, but yet smoking remains the greatest risk factor. Which of the following assessment and laboratory finding is most indicative of the presence of infection? 1500 of bacterial per ml on a urinalysis. Negative CVA tenderness, CVA costo-vertebral angle tenderness on percussion, tenderness to palpation of the abdomen, isolation of streptococcus in urine culture. Although 1500 colonies of bacteria per ml may indicate a UTI, it is not diagnostic of UTI. Therefore, a urine culture is required to isolate the particular bacteria which is present. In case of kidney infection, CVA percussion would produce a positive sign of tenderness and pain. CVA is costo-vertebral angle. The abdominal tenderness with palpation can be attributed to many causes and is not the most indicative of infection in this case. So here isolation of streptococcus in the urine culture is the most indicative of the presence of infection. An 80-year-old male presents for a physical examination and reports changes in his urinary pattern, including urinary frequency, hesitancy, and a low stream of urine. As a nurse, you recognize these findings are likely attributed to which of the following? Decreased bladder capacity related to age, renal failure, enlargement of the prostate gland, decrease in size of the kidneys. A majority of the males experience enlargement of the prostate gland, usually benign, with increasing age. This results in compression of the urethra and can explain subjective findings such as urinary frequency, hesitancy, staining upon urination, and a slow stream of urine. Although the bladder capacity and size of the kidneys decrease with age, these do not explain this patient's subjective reports. In case of renal failure, the amount and frequency of urine typically decreases. So here, the enlargement of the prostate gland is the likely finding. A 58-year-old female with a history of diabetes presents for a routine physical examination. A urinalysis is obtained and evaluated. The result indicates the presence of glucose in the urine. The nurse recognized that this indicates which of the following? Serum glucose of 150 mg per dl, serum glucose of 250 mg per dl, serum blood urea nitrogen of 12 mg per dl, serum blood urea nitrogen of 35 mg per dl. The presence of glucose in urine occurs when the renal threshold of glucose, that is 220 mg per dl is exceeded. So here serum glucose of 250 mg per dl. Serum blood urea nitrogen does not affect the presence of glucose in urine. The nurse expects to observe which of the following altered laboratory values in a patient diagnosed with renal failure: decreased calcium, decreased phosphorus, increased hematocrit. In renal failure, decreased calcium can occur as a result of the kidney's inability to respond in the process of converting vitamin D to its active form required for calcium to be absorbed from the GI tract. Calcium and phosphorus have an inverse relationship. So as calcium decreases in the case of renal failure, phosphorus increases. Hematocrit would be expected to decrease, not increase in the case of renal failure due to the decrease in erythropoietin that occurs in renal failure. The nurse is caring for an elderly patient with intermittent urinary incontinence. The nurse recognizes that the incontinence is a result of which structure failing to contract to keep urine in the bladder until maturation: the detrusor muscle, the external urethral sphincter, the urethra, the internal urethral sphincter. The internal urethral sphincter contracts to keep urine in the bladder until maturation. The sphincter is formed by the thickening of the detrusor muscle at the top of the urethra as it exits the bladder. The detrusor is the smooth muscle forming the inner layer of the bladder. The external urethral sphincter is formed as the urethra enters the pelvic floor and can be voluntarily contracted to keep urine from escaping the urethra, not the bladder, until the time to void is appropriate. The urethra is the tubular passageway through which urine exits the body. So here urine is kept in the bladder with the internal urethral sphincter. The nurse is assessing a patient for a routine physical examination. Which of the following are normal findings with assessing the renal and urinary systems? Inability to palpate the kidneys, severe tenderness upon percussion, absence of a renal artery bruit, purulent drainage from the urinary meatus, tympanic sound over an empty bladder upon percussion. It is normal for the kidneys to be non-palpable in healthy adults. This costovertebral angle tenderness upon percussion is abnormal and indicates a kidney infection. The presence of a renal artery bruit is abnormal and indicates turbulent blood due to narrowing of the artery or increased blood volume. Purulent drainage from the urinary meatus is abnormal and indicates the presence of an infection. Tympanic sounds would be elicited over a full bladder rather than an empty bladder. So here the normal findings are inability to palpate the kidneys, absence of a renal artery bruit. The nurse understands an abnormal voiding cystourethrogram, that is VCUG. Voiding cystourethrogram indicates which of the following: the presence of a mass in the bladder, an increased risk of kidney infection, incomplete emptying of the bladder, decreased creatinine clearance. An increased risk of kidney infection due to retrograde flow up the ureters. A voiding cystourethrogram is not looking for masses, incomplete bladder emptying or renal failure. So VCUG checks for an increased risk of kidney infection. The nurse is caring for a patient receiving IV contrast for a renal CT scan. Nursing responsibilities related to the administration of IV contrast include which of the following? To assess for allergies to contrast, iodine and seafood prior to the study, to educate the patient to increase fluid intake following the study, to obtain an order for NPO status following the study, to ensure that IV contrast is administered only through a central line, to assess the patient's baseline creatinine value prior to the study. Nursing responsibilities when caring for a patient receiving IV contrast for a radiographic study include assessing for allergies to contrast, iodine and seafood, patient education regarding increased fluid intake post-procedure, and assessment of the patient's baseline creatinine value. So first option, to assess for allergies, and the second, to educate the patient to increase fluid intake after the study, and also to assess the patient's baseline creatinine value. And if you see, the patient is not required to be on NPO for a CT scan for the renal system, and also the administration of IV contrast does not require a central line. The nurse caring for an 86-year-old female patient who presents with nocturnal polyuria incorporates which priority nursing diagnosis into the plan of care? Risk for deficient fluid volume, risk for sleep deprivation, risk for excess fluid volume, risk for urged urinary incontinence. Nocturnal polyuria, voiding frequently at night, indicates that the patient is producing poorly concentrated urine. Because of the poorly concentrated urine, frequent urination, decreased water weight and decreased effectiveness of ADH and aldosterone, geriatric patients are at increased risk for fluid volume deficit or dehydration. Although risk for sleep deprivation and risk for urged urinary incontinence are possible diagnoses, they are not the highest priority. The patient is not at risk for fluid volume excess also. Jones, a 72-year-old African-American male patient who presents to his healthcare provider with complaints of recent weight gain, swelling his hand and feet, voiding only small amount of urine and fatigue. His wife reports that he is not just himself and sometimes seems dazed. Mr. Jones has a history of depression and borderline hypertension which are not being treated with any medications. Mr. Jones has presented with complaints of decreased appetite, fatigue, 10 pounds weight gain over 2 months, changes in mental status and urinating only small amount of urine. Laboratory values reveal elevated BUN, creatinine, potassium, phosphorus and decreased calcium. A physical assessment reveals a lethargic gentleman with obvious pallor and peripheral edema in his extremities. The provider orders a renal ultrasound and a CT scan to assess for obstructions within the urinary tract. Both the ultrasound and the CT scan are negative for masses or obstruction, leading the provider to diagnose Mr. Jones with renal insufficiency, likely related to uncontrolled hypertension. The medical history shows borderline hypertension, BP 188/92 mmHg, heart rate 94 beats per minute, respiration 22, temperature 98.2 degree Fahrenheit, oxygen saturation 94% at room air. Follows commands yet appears lethargic, +2 non-pitting bilateral pedal edema, pallor with poor skin turgor, creatinine 1.8 mg per dl, BUN 40 mg per dl, BUN creatinine ratio 15:1, potassium 5.5 milliequivalents per liter, phosphorus 3.9 milliequivalent per liter, calcium 8.2 mg per dl. Mr. Jones is admitted to a medical unit for further monitoring and treatment of hypertension and his newly diagnosed renal insufficiency. The nurse has received the following provider order for Mr. Jones, who was recently admitted to the medical unit. Which order should the nurse plan to implement first? Administer 40 mg Lasix IV daily, implement fluid restriction less than 1500 ml per 24 hours, monitor urine specific gravity with each void, instruct the patient to follow a low sodium diet. Although each of the provider orders are appropriate for Mr. Jones, administering the diuretic Lasix is of highest priority to promote increased excretion of potassium and fluid in order to lower the BP, heart rate and decrease the peripheral edema. The remaining provider's orders should be implemented following the administration of Lasix. The provider orders a basic metabolic panel to be drawn 12 hours after Mr. Jones' admission. When the results are reported, the nurse recognizes that which of the following laboratory values should be reported to the provider most urgently. Creatinine 1.9 mg per dl, calcium 8 mg per dl, potassium 5.7 milliequivalents per liter, phosphorus 4.2 milliequivalents per liter. A potassium level of 5.7 milliequivalent per liter is indicative of hyperkalemia, and because of the dangerous cardiac arrhythmias that can result from hyperkalemia, this value requires a most urgent intervention. Although a creatinine of 1.9 mg per dl is above the normal range and is increased from Mr. John's previous lab results, it does not require as immediate intervention as the potassium level. A calcium level of 8 mg per dl indicates hypocalcemia, which is not an uncommon finding in a patient with renal insufficiency or renal failure. A phosphorus level of 4.2 milliequivalents per liter is within the normal range and therefore requires no intervention. The nurse caring for Mr. Jones should implement which of the following priority nursing interventions: strict monitoring of intake output, frequent monitoring of vital signs, administer supplemental oxygen, safety or fall precautions, obtain daily weights. Strict monitoring of intake output is required for patients with renal insufficiency or renal failure to carefully assess fluid balance status and ensure that the decreased functioning of kidneys does not result in fluid volume excess. Mr. Jones' vital signs reveals hypertension, which is a common finding in patients with renal insufficiency or renal failure. The blood pressure and pulse should therefore be frequently monitored, again as a measure of fluid balance status. Due to Mr. Jones' hypertension, his noted lethargy and reported altered urinary pattern, he is at risk for falls. Therefore, fall precautions should also be implemented. Measuring Mr. Jones' weight daily is another nursing intervention which needs to be done to yield data reflective of his fluid balance status. Mr. Jones' oxygen saturation is 94% and no other data reflect concern for oxygenation issues. Therefore, providing supplemental oxygen is not a priority nursing intervention at this time. The nurse caring for Mr. Jones incorporate which of the following priority nursing diagnosis into the plan of care: risk for falls, risk for imbalanced fluid volume, impaired urinary elimination, readiness for enhanced knowledge. The priority nursing diagnosis for Mr. Jones is risk for imbalanced fluid volume because of his renal impairment, which places him at a high risk of developing fluid overload. Although Mr. Jones is at a risk of fall, this is currently not the highest priority nursing diagnosis. Mr. Jones' urinary elimination pattern is impaired due to the renal impairment, yet it is not the highest priority nursing diagnosis. Mr. Jones' condition will require lifestyle and dietary modification. Therefore, readiness for enhanced knowledge is an applicable nursing diagnosis, yet not the highest priority diagnosis. Here, the highest priority is risk for imbalanced fluid volume. Which statement by Mr. Jones indicate that the discharge teaching by the nurse have been effective? I should carefully monitor and record my weight each day. If I am feeling well, I do not have to take my BP medications regularly. If I have aches and pains, I should take over-the-counter Mortin. I should try to increase the amount of potassium I take in my diet by eating at least one banana every day. At discharge, patients with renal insufficiency or renal failure should be taught to weigh themselves daily and record their weight to monitor for sufficient weight gain that would indicate fluid volume excess. Mr. Jones' statement that he does not need to take his BP medication if he is feeling well reflect the need for further teaching, as he should be taught to take his BP medication as ordered by the doctor every day, not to stop taking it if he is feeling well. Mr. Jones' statement that taking Mortin is acceptable indicates the need for further teaching, as Mortin is metabolized by the kidneys and not recommended for patients with renal impairment. Mr. Jones' statement regarding consuming more potassium daily indicates the need for further teaching, as patients with renal impairment should be taught to carefully regulate the amount of dietary potassium consumed due to the risk of hyperkalemia. Hope you understood this video. Thank you so much. Keep watching.